Dr. Blumenthal, when this legislation was signed and put into effect, how long had this legislation been in the system, the high-tech legislation? Or was this something that was just created?
Well, Congressman, there were a number of bills that had been close to passage in the past. As a matter of fact, bills similar to this legislation had passed the Senate and had actually passed the House and had failed to get agreement in conference. So many of the provisions were familiar to the health committees that had jurisdiction over this area. Now, my history is not authoritative in this regard, so I can only tell you what I observed at that time as a non-governmental.
And how long have you been with the department, Dr. Blumenthal?
Since April 20th, sir.
Okay, so not that long.
Not that long.
Okay. The HIT Policy Committee, what is the makeup of that? I don't know if you were talking about the advisory committee a while ago or the HIT committee. Well,
sir, we'd be glad to get you the roster of that group if you'd like to see it.
10 people, 12, 30?
23 people. And as I said, the great bulk of that membership was specified in law, or at least the process of appointment was specified in law. Mm-hmm. And virtually 20 of those 23 were appointed either by the GAO or by by the leadership of the House and the Senate.
Mm-hmm. And the membership, what's it made up of? I mean, what professions, what backgrounds?
Physicians, consumers, nurses, people who run neighborhood community health centers, people who are members of the health insurance community, people who are experts on privacy and security, and people who are expert in public health. There are some members of the federal government, representatives of the Department of Defense, the VA, the Office of Science and Technology Policy. So those are, but it's designed to be broadly representative of the stakeholders who are playing a role in, who have to be part of the process of health information technology adoption.
How about any people from the IT community?
Yes, we have people who have developed and sold health information technology. The chief executive officer of a company called Epic Care, and another gentleman who has started and run and sold two HIT companies.
How many companies provide the IT service to physicians and hospitals and provider?
I don't have an exact number for you. We can try to get that number, but I can tell you that the Certification Commission in the past has certified well over 100 ambulatory care products. So there are at least 100 discrete providers of health information technology. It's a very competitive market.
And I'm assuming that the real goal of this is that all of it will be interoperable, and with over 100 different companies providing this service, how are they, if we got any committee or anything that's looking into how they are working together to try to do that, and is that something that they're going to willingly do, because that will take some information trading, I guess, to be able to do that.
Well, Congressman, the House and Senate equipped us with two committees to advise the Office of the National Coordinator. One is the Policy Committee, which we've been discussing. There's another called the Health Information Technology Standards Committee. The critical element in communicating between different software are the standards that the software has to meet so that the information in both is recognizable to each system. And the Health Information Technology Standards Committee is tasked with advising the office on the standards that are required for interoperability. They've met twice as well. They have to, by statute, provide, not they, but the office with their advice has to provide an interim final rule by the end of the year on the standards that are required for certification. So we are under considerable time pressure to get those standards up and ready. We held a meeting of the Standards Committee yesterday. and they're providing invaluable advice. It's a complex, difficult undertaking, but we're hoping that the fact that the meaningful use definition that was outlined by the Congress does require interoperability will focus the vendors on that requirement and also focus the purchasers, small practices and large, hospitals, both individual hospitals and groups of hospitals, on the interoperability provisions and capabilities of the software they're purchasing.
Well, I see my time's up, and I hope that the chair lady will allow us to have one more round of questioning.